And now it's time for our interview. Our interviewee, who we'll just call Liz for privacy, is a friend of a friend who is currently going through ketamine therapy for major depressive disorder. We're going to ask her about why she sought out this treatment, why she chose MindBloom, and what her experience has been as she heads towards her first session. Check out this conversation and stay tuned for a follow-up interview coming soon where she breaks down what the experience was like. Check it out. Thanks, Liz, for talking to me about this experience coming up and just having this discussion. Let's just start with what was your journey to getting interested in this ketamine therapy and go from there.
Yeah, so I have been in treatment for major depressive disorder since about 2002, 2003. So I've been in therapy on and off this entire time. And I find that in general, the medications themselves don't give much relief, or they give some relief, but only so much. And that even with all the different therapy I've been through, ultimately, I have come to a greater understanding of what the underlying causes are of my depression, but I haven't been able to get to that next level of like actually treating it to a point where I feel I'm living like my like fullest life, and in a way that I don't go in and out of these like peaks and valleys. About a year, like last summer, I actually spoke to my prescribing nurse practitioner about trying out ketamine, and they said that they had no issue with it, but they personally don't have any practitioners at the clinic that um, use the drug. I did the research into the esketamine, into the IV infusion clinics, and came to the conclusion that it was just prohibitively expensive. I would have had to spend roughly about like $10,000 on the IV infusions to get the full course of treatment, and so I tabled it until recently when a friend of mine recommended this service called MindBloom, which offers the medication in a tablet form that you take under the tongue, and it dissolves. And because of that method of treatment, it is much more affordable, even if you're paying out of pocket. So 4 treatments come out to about $1,000, and that's inclusive of all the counseling that they give, the kit itself with the medication and other tools and things that they give along with it, which I could get into more in a bit.
So, what's your understanding about how this is supposed to work, or why ketamine has this ability?
With the ketamine, it works on a totally different system, like the glutamate system. I'm not really like, I'm not a scientist. But my understanding is that like, unlike all the other classes of antidepressants, this works very differently to kind of rebuild the neural synapses that have been damaged by the depression. So there is a real physiological component to it when they've looked at it under like MRI when the patients have been in MRI machines. But that also, the other layer to it is the actual experience of taking it, the dissociative effect that it causes, and even hallucinatory effects, similar to other types of so-called psychedelic drugs, that it can impact the way that you perceive yourself in the world at large, and that somehow that has a positive long-term effect. I don't, I've seen and read a lot of different, versions of this. Like some people have like a very like strong reaction, others it's more mild. So yeah, we'll kind of see. I've never personally had a strong psychedelic experience. I've dabbled in low dose, like microdosing of psychedelics. So it'll be interesting to see how this goes.
Yeah, absolutely. So tell us a little more about like what the process has been. So you chose MindBloom because it was accessible, it was affordable, because you can actually do it at your house through this dissolvable tablet instead of having to go into a clinic, get an IV actually into your arm. So once you made that choice, you signed up for MindBloom. Like, how's that process been going?
There's a screening, first of all. So if you have certain pre-existing conditions, like medical conditions, or a history of suicidal ideation within the last month or so, they exclude you from being able to take the medication. So I had to first go through a screener online, and then again, like do the interview with the psychiatric nurse who will be working with me throughout the whole process. And so she gave me the same screener and asked me a bunch of questions, and then we talked about what it's going to be like. That I'm going to get this medication in the mail. It comes with I will also get an anti-nausea medication because some people feel that they get a little bit nauseous at the beginning of it, so I'll get that. I also got a blindfold, like mask, like eye mask, a journal, a blood pressure monitor. They want you to check your blood pressure before, during, and possibly after. I have to go look at the literature again. There's also a component of you need to have a monitor, like a buddy system, basically. So since it's being done remotely, you'll check in with the clinician right before the treatment starts, and then you have to have, and during that meeting, your buddy will be there to also listen to all of the different things that they need to do. Check your blood pressure, come in and check on you every 15 minutes, make sure you're doing okay. You're not allowed to get up on your own if you have to go to the bathroom, for instance. That's what they're there for, is to like walk you over to the bathroom and just keep an eye on you, make sure you're safe and comfortable. And then when it's all said and done, you check back in again. You do another Zoom. It's going to be through Zoom or some like platform like that, where you'll discuss like what the experience is like, kind of process everything. In between the end of the treatment and the next and that video call, they want you to also journal. So they want you to write everything that you recall from the experience and your thoughts and feelings. So it's kind of a comprehensive, holistic approach. Again, like that also appealed to me because with the IV infusions, most places it's like they just hook you up to the IV. They put on some music and they walk away and they come back and they're like, "How you doing? Okay, fine, you can go home." So it doesn't. There's no requirement that you have therapy along with it. They don't even like. I mean, they did say that they would talk to the psychiatric nurse said that she would speak with my therapist that I'm seeing right now just to touch base, but it's not required. But the fact that they even offer that, I think, already shows that there's more involvement, a multidisciplinary approach to it.
How long is the session about?
Not including the before and after like check-in, it's like about an hour. So the whole thing will take about 45 minutes to an hour to go through the entire treatment with the ketamine. I think it takes, the peak of it is about 20 to 30 minutes in, and then between like 20 and 45 minutes you'll have the experience, and then you start to come down the last 15 minutes.
So you said that they offered to talk to your like therapist you already see. Is there like a therapy session with the psychiatric nurse? Are you talking to her about, yeah, intentions during the experience, or how you're going to think through your thoughts when you're in the experience? Like, what does she kind of guided you through?
Yeah, that's going to be the pre meeting to discuss my intentions for the therapy. They want you to be as comfortable as possible, and also talk about what your expectations are and what you plan to get out of it. And it's also just a way to sort of calm people, because some people might find it a frightening experience, and so being clear on what the intention is, what's going to happen, any expectations you have, and so on, help make it a smoother process for the patient. So that's the plan.
So you haven't yet had those kind of conversations with the psychiatric nurse, but like just 10 or 20 minutes before you take the treatment is when you'll have that initial conversation, and then
That's
one
correct.
right afterwards, and then are there multiple sessions?
Yeah. So typically you are signed up for 4 sessions. Um, the next three are more self-guided. They'll give you materials online to go through. You can still always contact them. They also set me up with a consultant via text that who herself apparently was a patient and now works for MindBloom. So you can also talk to them about the experience and get some feedback if there's any, any concerns you have. So yeah, the reason why they set it at 4 is because some people after the first one feel that they need a higher dose. They start the way the dosing works is completely based off of your weight. Um, and so they don't really know exactly how much you're going to need until you do it. So the basing it off the weight is really just the way that they typically work with anesthetics anyway, right? So they weigh you and get your height and they make sure that they're giving the appropriate dose. But it's not necessarily therapeutic based on anything else. Like they don't know how I'm going to react. Like it might be like just just below the psychedelic level, like just kind of like a lubricant. But they what their goal is to get me like just a little bit above that level, but not totally. They said in like outer space, if that makes sense. Um, so we'll know better after the first time, and then the second time they can adjust it accordingly. And also, I think there's sort of a I don't know if it's like so much of a buildup as much as each time you come away with a different experience. And so cumulatively, they find that it takes at least 4 sessions to have the most robust effect.
Yeah, that's pretty interesting. And I know that we both are kind of reading through the Michael Pollan book, How to Change Your Mind. And they talk a lot about like the trip sitters or the clinicians in that book and the role that they play, especially, I suppose, in like a 6 hour psilocybin trip versus, a 20 or 45 minute ketamine trip. Do you feel pretty comfortable with like the support that they've given you? Do you like.
Yeah, I think it's been really reassuring. Also, it's interesting to bring that up about the difference in how long the trip is. I think that's also a big um, uh, positive for me, that if it's not pleasant, it'll be over, versus like 6 hours where, a lot, I mean, you really have to set aside a whole day, and like it could be good, it could be bad, or somewhere in between. So, the worst case scenario is it's an hour and then it's over and we'll see how it goes. So, yeah, I think that it's also having, the psychiatric nurse, having my partner there. We're planning to actually do it on a trip upstate. We're heading up on Monday, so it's actually scheduled for next Saturday. And so I felt that that was like a good time and place to do it, because we'll be in a very quiet place in the woods, and there won't be any like disturbances. Pre-COVID, actually, you could go to their clinic to do this. Um, they still did it with the sublingual tablets, but you were able to go in person. Now, given the circumstances, they're able to send it to people's homes. There's like a special compound pharmacy that puts together the kit and mails it directly to you.
Well, that's most of my questions, but I'm just curious to kind of open-ended, how are you feeling about the session coming up, and why did you want to have this conversation, and how do you feel about the whole idea?
Yeah, I feel fairly. I mean, I would say I am a little bit nervous because I just, at the end of the day, like no matter how many different videos I watch of people doing it, even from watching all those different clips, I still have no idea what to expect. I just hope that to me, I'm almost more like interested in just like the outcome, like how am I going to feel afterwards versus the actual being in the middle of it. Does that make sense? Um, Although maybe the two are intricately linked and you can't really separate them, right? So um, that said, the reason I wanted to have this conversation was that uh, I think this kind of speaks to a larger issue of just how mental health is treated in this country, which is not very well. Even if you have resources like I do in terms of having health insurance that covers for treatment, which I'm very fortunate and privileged to have, you still get the runaround and don't really get treated. They almost treat like your condition and not you as a person. And that's how I felt a lot of the time, especially with those who prescribe medication. I think it'll be good to chat again maybe afterwards to kind of do a postmortem,
Yeah.
yeah, on how things went.
Yeah, and I think it is. I mean, I'm sure you feel that you're playing some small role to start changing the conversation about mental health and about these alternative therapies, and I definitely think you are. So thanks for having this conversation with us and being as frank as you've been. And yeah, let's definitely talk again on the other side of it and see how you felt about it.
Thanks, Mike.
and don't forget to subscribe below.